This module was created by Nipissing University's Best Practice Spotlight Organization team based on the Registered Nurses Association of Ontario's Best Practice Guideline Preventing Falls and Reducing Injury from Falls. The Nipissing University BSCN program is undergoing a pre-designation to become a Best Practice Spotlight organization. This project is funded by the RNAO in conjunction with the Ministry of Health and Long-Term Care. Disclosure. This presentation is based on the RNAO Best Practice Guideline Preventing and Reducing Injury from Falls. This is a general guideline on how to use best practice guidelines based on your academic year. In first year, knowledge of the best practice guideline and assessment using best practice guidelines. It's an introduction to BPG order sets. Second year, clinical exposure to application of best practice guidelines. Third year, knowledge and use of best practice guidelines in complex settings. And fourth and fifth year is the application of best practice guidelines in complex scenarios utilizing more critical thinking. When reviewing this guideline for application, it should be applied in accordance with the individual at risk of falls and the organization needs and practice setting. This guideline provides an overview of supports and appropriate structures in order to provide the best possible evidence-based care. This video further looks into the RNAO's Best Practice Guideline, Preventing and Reducing Injury from Falls. Personal and economic costs of falls. The impact of a fall can be life-changing and can greatly affect an individual's quality of life, including loss of independence. When caring for a patient who has fallen, it is important to keep in mind that a series of negative effects can follow. Physical injuries can be minor or have a major impact on the individual's health. Minor injuries can include bruising or abrasions, and major injuries can include fractures or head injuries that can further lead to the individual becoming hospitalized or even their death. Many of those who fall become timid and anxious of reoccurrence, and this leads to a cycle of social withdrawal, reduction in physical activities, causing muscle weakness, deconditioning, and a higher chance of falling again. Falls are also expensive for the healthcare system and cost an estimated $8.7 billion per year. This is due to the lengthened stay within a facility until full recovery or transfer is made. Healthcare providers play a critical role in decreasing the amount of falls and associated injuries by practicing with evidence-based knowledge on fall prevention initiatives and working to implement and evaluate interventions addressed in this guideline. The magnitude of falls. In Canada, falls are the leading cause of injury, deaths, disabilities, and hospitalizations. 30% of people greater than 65 who live in the community fall at minimum once per year. 50% of people older than 80 who live in the community fall at minimum once per year. 95% of all hip fractures are related directly to falls, and 20% prove fatal. Fall prevention and health promotion strategies. Due to the economic impact, detrimental effects, and the overall magnitude of falls, fall prevention has become a quality improvement priority for health and safety. Within the community, there are public health mandated programs addressing fall prevention. An example of one program is the Ontario Public Health Standards. Fall prevention programs are often mandated within institutions, including hospitals and long-term care. With these programs in place, compliance is often monitored. Organizations must implement and evaluate an approach for fall prevention. Ontario has a required program for fall prevention and management that is required and measured through compliance in long-term care homes. Risk factors. Risk factors can be modifiable or non-modifiable. They can also be categorized as economic, social, behavioral, biological, also known as intrinsic, or environmental, also known as extrinsic. The College of Occupational Therapists have identified over 400 risk factors impacting falls. Various factors within healthcare organizations can increase the risk for falls. These can include the assessment process, inconsistent interventions, or poor communication across the healthcare setting. The AMDA states in order to prevent and reduce falls, healthcare providers must instill a balance between diminishing the risks and maintaining an individual's freedom and quality of life. Mayak Lee et al. Discuss how organizations should avoid any adverse approaches, including restricting mobility, physical restraints, or any sedating medications. This graphic goes over the falls risk factor group. It looks at behavioral or psychological, biological, environmental or situational, and socioeconomic. This graphic looks at the conditions that increase risk of falls. Some conditions include cancer, dementia or cognitive impairment, hemophilia, multiple sclerosis, osteoarthritis, osteoporosis, overall frailty in older age, Parkinson's disease, psychiatric illness, risks for non-ambulatory adults, device-related characteristics, and stroke, along with bleeding risk, fracture risk, and skin integrity risk. This chart outlines fall prevention and injury reduction. Purpose of guideline. This best practice guideline focuses on fall injuries and the prevention of falls within the adult population and those who are at risk for falls. It refers to those receiving care by healthcare practitioners, whether in institutions or within the community. The aim of this guideline is to address evidence-based approaches in order to prevent falls and reduce the amount of fall injuries in the adult population. Guiding principles. Fall prevention is a shared responsibility within healthcare. Falls are predictable and can be preventable, but not all falls are preventable, so it is crucial to prevent falls and the frequency of these events. The risks and benefits of the individual should be analyzed before interventions are implemented or to minimize injuries. Person and family-centered care is the base for those who are at risk for falls. Adults who are competent do have the right to take risks, meaning the decisions they make or actions taken are their choice. Best practice recommendations are provided in 3 areas. Number 1 is practice. Frontline interprofessional team who provide care to individual across all practice settings. 2 is education. Those who provide interprofessional and staff education. And number 3, system, organization, and policy. This can vary depending on the recommendation. It can include administration, managers, government bodies, policymakers, or regulatory bodies. As nursing students, the focus will be on practice recommendations. It is still beneficial to be aware of the educational and system, organization, and policy recommendations as well. What is a gap analysis? It's the difference between current knowledge and practices, so what we are currently doing, and current evidence-based practices, so what we should be doing. Gaps can occur in knowledge, skills, or practice. It is important when you look through this guideline to reflect on the following questions and be specific. Where is our current practice? Where do we wish we were / where should we be? Why has this gap occurred? And how are we going to close this gap? Performing a gap analysis on best practice guidelines is an essential part of reflecting on practice. When reviewing the recommendations, identify where there are gaps in current practice or knowledge and take the time to reflect. Steps to conduct a gap analysis. Step 1. Perform a needs assessment. Step 2. Determine the educational gaps in knowledge, skills, or practice. What is the best practice? Step 3. Determine purpose of the activity and program objectives and design. Step 4 is course development. Step 5, implement the activity. And step 6 is to evaluate the activity. Now we will begin to look at the recommendations on the best practice guideline preventing falls and reducing injury from falls. Objective 1, assessment. 1.1. Screen all adults to identify those at risk for falls. Conduct screening as part of admission processes after any significant change in health status, or at least annually. Screening should include the following approaches: identifying a history of previous falls, identifying gait, balance, and/or mobility difficulties, and using clinical judgment. 1.2. For adults at risk for falls, conduct a comprehensive assessment to identify factors contributing to risk and determine appropriate interventions. Use an approach and/or validated tool appropriate to the person and the healthcare setting. 1.2b. Refer adults with recurrent falls, multiple risk factors, or complex needs to the appropriate clinician or to the interprofessional team for further assessment and to identify appropriate interventions. Objective 2, planning. 2.1. Engage adults at risk for falls and fall injuries using the following actions. Explore their knowledge and perceptions of risk and their level of motivation to address risk. Communicate sensitively about risk and use positive messaging. Discuss options for interventions and support self-management. Develop an individualized plan of care in collaboration with the person. Engage family, as appropriate, and promote social support for interventions and evaluate the plan of care together with the person and family and revise as needed. 2.2. Provide education to the person at risk for falls and fall injuries and their family, as appropriate, in conjunction with other fall prevention interventions. This includes providing information about falls risks, falls prevention, and interventions. Ensure that the information is provided in a variety of formats and in the appropriate language. 2.3. Communicate the person's risk for falls and related plan of care/interventions to the next responsible healthcare provider and/or the interprofessional team at all care transitions to ensure continuity of care and to prevent falls or fall injuries. 2.4. Implement a combination of interventions tailored to the person and the healthcare setting to prevent falls or fall injuries. 2.5. Recommend exercise interventions and physical training for adults at risk for falls to improve their strength and balance. Encourage an individualized, multi-component program and activity that corresponds to the person's current abilities and functioning. 2.6. Collaborate with prescribers and the person at risk for falls to reduce, gradually withdraw, or discontinue medications that are associated with falling when the person's health condition and change in status allows. This includes the following actions. Identify polypharmacy and medications that increase risk for falls. Conduct a medication review or refer to appropriate healthcare provider and/or prescriber, and monitor for side effects of medications known to contribute to risk for falls. 2.7. Refer adults at risk for falls or fall injuries to the appropriate healthcare provider for advice about vitamin D supplementation. 2.8. Encourage dietary interventions and other strategies to optimize bone health in adults at risk of falls or fall injuries, particularly those at risk for fracture. Refer to the appropriate healthcare provider for advice and individualized interventions. 2.9. Consider hip protectors as an intervention to reduce the risk of hip fracture among adults at risk for falls and hip fracture. Review the evidence, potential benefits, harms, and barriers to use with the person to support individualized decisions. Objective 3. Implementation. 3.1. After a person falls, provide the following interventions. Conduct a physical examination to assess for injury and to determine the severity of any fall injuries. Provide appropriate treatment and care. Monitor for injuries that may not be immediately apparent. Conduct a post-fall assessment to determine factors that contributed to the fall. Collaborate with the person and the interprofessional team to conduct further assessments and determine appropriate interventions. And refer the person to the appropriate healthcare providers for physical rehabilitation and/or to support psychological well-being, as needed. This chart looks at fall interventions alongside a description and research findings that support the rationale. This graphic outlines common universal fall precautions, looking in categories of general, bed or chair, and slipping. Objective 4. Evaluation. 4.1. Educational institutions incorporate content on fall prevention and injury reduction into healthcare education and training programs. 4.2. Healthcare organizations provide ongoing organization-wide education to all staff in conjunction with other activities to help prevent falls and reduce injuries among persons in their care. How to prevent a fall. There are many things you can do to avoid falls and stay independent. 1. Exercise and activity programs. Choose activities that focus on muscle strength and balance. These are the best for helping prevent falls and protect you from injuries. Choose an activity or program you enjoy and that matches your abilities. Number 2. Check your surroundings and footwear. Remove things that might cause a slip or trip in your home. Example, loose rugs. Make sure you have good lighting and secure handholds. Example, railings for stairs. Wear sturdy shoes that fit well and have a good grip on the soles. 3. Talk to your healthcare provider about cutting down or changing medications that could increase your risk for falls, ways to keep your bones strong, example, foods or vitamins, and other ways to prevent falling that are just right for you. Listed below are the education and system organization and policy recommendations related to this best practice guideline for your reference. Objective 5. Education recommendations. 5.1. To ensure a safe environment, implement universal fall precautions and identify and modify equipment and other factors in the physical/structural environment that contribute to risk for falls and fall injuries. 5.2. Organizational leaders, in collaboration with teams, apply implementation science strategies to enable successful implementation and sustainability of falls, prevention or injury reduction initiatives. This includes identifying barriers and establishing formalized supports and structures within the organization. 5.3. Implement rounding as a strategy to proactively meet the person's needs and prevent falls. This chart outlines research gaps and future limitations.